Welcome to the recorded webinar, Improving the Quality Measures, Percent of Low-Risk Long-Stay Residents Who Lose Control of Their Bowel or Bladder. This webinar is part of a series intended to help nursing homes understand and improve the 13 long-stay measures that are used to calculate the Quality Measure Composite Score. The measure being reviewed is the percent of long-stay residents who frequently lose control of their bowel or bladder. The numerator for this measure is the number of long-stay residents with a selected target assessment that indicates frequently or always incontinent of bladder. So H0300 would be coded as 2 or 3, or frequently or always incontinence of bowel, H0400 would be coded as 2 or 3. The denominator for this measure is all long-stay residents with a selected target assessment except those with exclusions. And there are 8 exclusions for this quality measure. The first exclusion is that the target assessment is an admission assessment, so A0310A is coded as 1, or the target assessment is a PPS 5-day assessment. A0310B would be coded as 01. The second exclusion is that the resident is not in the numerator and urinary or bowel continence was not assessed. So it would be coded as a dash in H0300 or H0400. The third exclusion is that the residents have any of the following high-risk conditions. Severe cognitive impairment on the target assessment, so C1000 would be coded as 3, and C0700 would be coded as 1, or C0500, the summary cognitive score, would be coded at or less than 7. The next high-risk condition that excludes a resident is total dependence in bed mobility self-performance. So G0110-0A1 would be coded as 4, 7, or 8. The next high-risk condition that excludes a resident is total dependence in transfer self-performance. G0110-B1 would be coded as 4, 7, or 8. The next high-risk condition that excludes a resident is total dependence in locomotion on unit self-performance. So G0110-E1 would be rated as 4, 7, or 8. The fourth exclusion for this quality measure is that the resident does not qualify as high risk, and both of the following 2 conditions are true for the target assessment. First of all, C0500, the summary score for the brief interview for mental status, would be coded as 99, which means the resident is unable to complete the interview. A caret, which would indicate the item was skipped, or a dash, which would indicate the item was not assessed. And C0700 short-term memory is okay, is coded as a caret, which indicates the item was skipped, or a dash, which would indicate the item was not assessed. Or C1000, cognitive skills for daily decision making, is coded as a caret, which would again indicate the item was skipped, or a dash, which means it was not assessed. The fifth exclusion is that the resident does not qualify as high risk, and any of the following 3 conditions are true. G0110A1, which is bed mobility, is coded as a dash because it wasn't assessed. G0110B1, which is transfer, is coded as a dash. And G0110E1, locomotion on unit, is coded as a dash. The sixth exclusion for this measure is that the resident is comatose. So B0100 would be coded as 1, or a dash, which means it was not assessed on the target assessment. The seventh exclusion is that the resident has an indwelling catheter, H0100A is checked, or an indwelling catheter is missing, which would be coded as a dash, which means it is not assessed on the target assessment. The eighth and last exclusion for this measure is that the resident has an ostomy, H0100C is checked, or the ostomy status is missing, so H0100C is coded with a dash. To help identify what your team can do to improve this quality measure, refer to the RAI Manual Appendix C to find the care area assessment for urinary incontinence. The care area assessment provides a framework for guiding the review of triggered areas and clarification of a resident's functional status and related causes of impairments. It also provides a basis for additional assessment of potential issues, including risk factors. The assessment of the causes and contributing factors gives the interdisciplinary team additional information to help them develop a comprehensive plan of care. For each resident who triggers for this quality measure, identify modifiable factors contributing to transitory urinary or bowel incontinence, identify other factors that contribute to incontinence, and review relevant laboratory test results. In addition, identify diseases and conditions that contribute to incontinence, the type of incontinence, medications that contribute to incontinence, and review input from the resident and/or the family or representative. Then, analyze your findings, and for each resident, document a description of their incontinence, the causes and contributing factors for their incontinence, as well as the factors that put the resident at risk for incontinence. This information should then be used in the development and implementation of an individualized plan of care for each resident, which should decrease their episodes of incontinence and help improve this quality measure. Implementing quality improvement in your nursing home works best if your home has a culture of quality that supports continuous quality improvement. Please refer to the CMS National Nursing Home Quality Care Collaborative Change Package that offers strategies your team can implement to develop and enhance your quality culture. One of the strategies of high-performing nursing homes found in the Change Package is to provide exceptional, compassionate clinical care that treats the whole person by striving to prevent problems. Promoting continence is a great example of the strategies. Please refer to the link on this slide to find other proven strategies to improve the quality culture within your nursing home. Refer to the MDS 3.0 RAI Manual and the MDS 3.0 Quality Measure User's Manual for more information about the quality measures. To clarify questions about the MDS and/or the quality measures, contact your state RAI coordinator. For further information about the quality measures or about the Nursing Home Quality Care Collaborative, please contact your state Lake Superior Quality Innovation Network lead listed on this slide. Be sure to check out our short videos on each of the 13 quality measures that make up the composite score. Viewing the videos for each of the measures will help your team understand how each measure is calculated and will offer suggestions on first steps to improve each quality measure.